Hello and welcome to this video on understanding the basics of dialectical behavioral therapy, commonly known as DBT. DBT is a comprehensive and evidence-based therapy that has been developed by Dr. Marsha M. Leinen to help individuals manage their emotions, develop healthy coping mechanisms, and improve their overall quality of life. In this video, we will explore the core principles of DBT, its origin, and how it can be helpful for people struggling with various mental health conditions. Part 1. The origins of DBT. To understand DBT, we must first delve into its origin. DBT was initially developed in the 1980s by Dr. Marsha M. Leinen, a psychologist who was working with individuals who had chronic suicidal tendencies and borderline personality disorder, or BPD. Dr. Leinen found that traditional behavioral therapy was not effective in treating these individuals, so she developed DBT as a more comprehensive and effective approach. DBT has since been proven to be useful for a range of mental health issues, including anxiety, depression, substance abuse, and eating disorders. Part 2. The core principles of DBT. The core principles of DBT are centered around the idea that individuals can learn new behaviors and coping mechanisms to manage their emotions and improve their overall well-being. The four main principles of DBT are mindfulness. Mindfulness is the practice of being present in the moment and aware of one's thoughts, emotions, and physical sensations. In DBT, individuals are taught to practice mindfulness to help them stay in the present and manage their emotions. Distress tolerance. Distress tolerance is the ability to tolerate difficult emotions without resorting to harmful behaviors. DBT teaches individuals healthy coping mechanisms to manage distress, such as distraction techniques and self-soothing activities. Emotion regulation. Emotion regulation is the ability to identify, understand, and manage one's emotions. DBT teaches individuals how to regulate their emotions in a healthy way by using skills such as problem solving and positive self-talk. Interpersonal effectiveness. Interpersonal effectiveness is the ability to communicate effectively with others and maintain healthy relationships. DBT teaches individuals how to communicate assertively, set boundaries, and resolve conflicts in a healthy way. Part 3. The components of DBT. DBT is a comprehensive therapy that typically includes four components. Individual therapy. Individual therapy is a one-on-one session with a trained DBT therapist. In individual therapy, individuals work on developing and implementing skills to manage their emotions and improve their overall well-being. Group skills training. Group skills training is a group session where individuals learn and practice the core principles of DBT, including mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness. Phone coaching. Phone coaching is an opportunity for individuals to reach out to their therapist for support in a crisis situation. This component of DBT is particularly helpful for individuals who struggle with intense emotions and need additional support outside of therapy sessions. Consultation team. The consultation team is a group of DBT therapists who meet regularly to support each other in implementing DBT with their clients. The consultation team also helps therapists stay accountable and adhere to the principles of DBT. Part 4. How DBT can help you. DBT can be helpful for individuals struggling with a range of mental health conditions, including borderline personality disorder, depression, anxiety disorders, substance abuse, eating disorders. DBT can also help individuals develop healthy coping mechanisms, manage their emotions, and improve their overall quality of life. With the help of a trained DBT therapist, individuals can learn new skills and strategies to manage their emotions, reduce impulsive behavior, improve their communication, and build better relationships. One of the key benefits of DBT is its focus on acceptance and validation. DBT emphasizes the importance of accepting individuals as they are without judgment or criticism. This can be particularly helpful for individuals with BPD who may have experienced invalidation and rejection in the past. DBT also recognizes the importance of therapeutic relationship between the therapist and the client. A strong therapeutic relationship can help individuals feel more supported, heard, and understood. This can help build trust and make it easier for individuals to open up and share their thoughts and feelings. Part 5. Getting started with DBT. If you're interested in DBT, the first step is to find a trained DBT therapist. You can ask your healthcare provider for a referral or search for a therapist online. It's essential to work with a therapist who is trained in DBT and has experience working with individuals who have similar mental health conditions. Once you've found a therapist, they will work with you to develop a treatment plan tailored to your specific needs. You may attend individual therapy sessions, group skills training sessions, and have access to phone coaching and consultation team meetings as needed. It's important to remember that DBT is not a quick fix, and it may take time to see significant progress. However, with consistent practice and support, individuals can learn new skills and strategies to manage their emotions, improve their relationships, and live a more fulfilling life. Here are some additional information and insights on DBT. DBT was initially developed for individuals with borderline personality disorder or BPD. BPD is a mental health condition characterized by intense emotions, unstable relationships, and impulsive behavior. DBT has since been shown to be effective for other mental health conditions, including depression, anxiety disorders, substance abuse, and eating disorders. DBT is a structured therapy that typically involves 6 to 12 months of treatment. However, duration of treatment can vary depending on the individual's needs and progress. DBT is often delivered in a multidisciplinary team approach, meaning that the therapist may collaborate with other healthcare professionals, such as psychiatrists, to provide holistic care. DBT emphasizes the importance of a non-judgmental stance, where individuals are encouraged to accept themselves and their experiences without criticism or self-blame. This approach can be particularly helpful for individuals who have experienced trauma or invalidation in the past. DBT skills are organized into 4 modules: mindfulness, distress tolerance, emotional regulation, and interpersonal effectiveness. Each module increases several skills that individuals can learn and practice in their daily lives. Mindfulness is a core component of DBT and involves paying attention to the present moment without judgment. Mindfulness practices can help individuals develop awareness of their thoughts, feelings, and physical sensations, which can help them manage their emotions more effectively. Distress tolerance skills can help individuals cope with difficult emotions, such as anger, sadness, and anxiety. Distress tolerance skills include activities like self-soothing, distraction, and radical acceptance. Emotional regulation skills can help individuals identify and manage their emotions in a healthy way. Emotion regulation skills include techniques like mindfulness of emotions, problem solving, and opposite action. Interpersonal effectiveness skills can help individuals improve their communication and build better relationships. Interpersonal effectiveness skills include techniques like assertiveness, validation, and relationship repair. DBT can be delivered in different formats, including one-on-one therapy, group therapy, and intensive outpatient programs. The format of treatment may vary depending on the individual's needs and preferences. DBT includes a hierarchy of treatment targets that are prioritized based on the individual's needs and the stage of treatment. The hierarchy includes reducing suicidal and self-harm behaviors, reducing therapy-interfering behaviors, reducing quality of life-interfering behaviors, and increasing skillful behaviors. DBT therapists use a dialectical approach, which means that they help individuals understand and resolve the contradictions or conflicts in their thoughts and behaviors. For example, an individual may want to improve their relationships but struggle with setting boundaries. The therapist can help the individual understand and resolve this conflict by using a dialectical approach. DBT also emphasizes the importance of self-care and healthy lifestyle habits. Individuals are encouraged to engage in activities that promote their physical, emotional, and mental well-being, such as exercise, healthy eating, and relaxation techniques. DBT has been adopted for different populations, including adolescents, veterans, and individuals with co-occurring disorders. The principles of DBT remain the same, but the treatment may be modified to meet the specific needs of the population. DBT has been shown to be effective in reducing suicidal behaviors, self-harm, and hospitalizations among individuals with BPD. DBT has also been shown to be effective in reducing symptoms of depression, anxiety, and substance abuse. DBT requires a commitment to the therapeutic process and a willingness to practice the skills learned in therapy. DBT therapists often assign homework assignments and encourage individuals to practice the skills in their daily lives. DBT is not a one-size-fits-all approach, and individuals may require different levels of care and support depending on their needs. DBT therapists work with individuals to develop a personalized treatment plan that meets their unique needs. DBT is based on a bio-psycho-social model of mental health, which means that it recognizes the interplay between biological, psychological, and social factors in mental health. DBT therapists work with individuals to address all of these factors in their treatment. DBT is a strengths-based approach that focuses on individuals' existing skills and abilities. The therapist works with the individual to enhance their strengths and build on their existing coping mechanisms. DBT also emphasizes the importance of validation, where individuals' experiences and emotions are acknowledged and understood. Validation can help individuals feel heard and understood, which can be particularly helpful for individuals with BPD who may have experienced invalidation in the past. DBT can also include skills for managing crisis situations, such as suicidal ideation or self-harm urges. Individuals are taught skills to help them manage these situations in a safe and healthy way. DBT is an active and collaborative therapy, where the therapist and the individual work together to develop treatment goals and strategies. The therapist provides guidance and support, but the individual is ultimately responsible for practicing the skills and making progress. DBT can be a challenging therapy, as it requires individuals to confront their emotions and behaviors in a non-judgmental way. However, with practice and support, individuals can learn to regulate their emotions and build a life worth living. DBT is based on scientific principles and has been extensively researched. Studies have established that DBT is effective in reducing self-harm, suicidal behaviors, and hospital admissions among people with BPD. DBT has also been shown to be effective in reducing symptoms of depression, anxiety, and substance abuse. DBT is a comprehensive therapy that can be tailored to meet the specific needs of the individual. The therapist works with the individual to develop a treatment plan that addresses their unique challenges and goals. DBT can be beneficial for individuals who have tried other therapies without success. DBT's comprehensive approach and focus on skills development can provide individuals with the tools they need to manage their emotions and improve their overall well-being. DBT is an integrative therapy that incorporates elements of cognitive behavioral therapy, mindfulness, and dialectics. It is designed to address the complex needs of individuals with multiple co-occurring mental health concerns. DBT includes a variety of skills for managing different types of emotions, such as anger, anxiety, and sadness. These skills can help individuals learn to tolerate difficult emotions without resorting to self-harm or other harmful behaviors. DBT therapists use a structured approach to therapy, where individuals learn skills in a specific order. This approach can help individuals build a foundation for managing their emotions and developing healthy behaviors. DBT therapists also use behavioral chain analysis to help individuals understand the factors that contribute to their emotions and behaviors. This approach can help individuals identify patterns and triggers which can be addressed in therapy. DBT includes a commitment to ongoing learning and growth, both for the individual and the therapist. DBT therapists receive extensive training and supervision to ensure that they provide high-quality, evidence-based care. DBT is a flexible therapy that can be adapted to meet the needs of different individuals and populations. For example, DBT can be delivered in individual or group therapy format, and it can be adapted for use in different settings, such as schools or correctional facilities. DBT therapists use a non-judgmental approach where individuals are encouraged to accept themselves and their experiences without criticism or self-blame. This approach can help individuals build self-compassion and improve their self-esteem. DBT can also include family therapy or couples therapy, where the therapist works with the individual and their loved ones to improve communication and build healthy relationships. DBT is not a cure for mental health conditions, but rather a tool for managing symptoms and improving overall well-being. Individuals may need ongoing therapy or support to maintain their progress. In conclusion, DBT is a comprehensive and evidence-based therapy that can be helpful for individuals struggling with a range of mental health concerns. By practicing mindfulness, distress tolerance, emotional regulation, and interpersonal effectiveness, individuals can learn new behaviors and coping mechanisms to manage their emotions and improve their overall well-being. If you're interested in DBT, reach out to a trained therapist to discuss how DBT can help you on your journey towards healing and growth. If you're interested in discovering more about psychology and therapies, then be sure to check out this video at the first link in the description. Subscribe and turn on notifications so you don't miss more videos helping you learn about psychology and more. Check out this video relating to impulsivity and impulsive behavior, and I'll see you in the next video. Take care.